Hi students, welcome to Angel Health Academy. Topic for the day is hospital administration. In this video, I would like to talk about hospital administration, which includes hospital meaning, hospital definition, objectives of hospital, functions of hospital, and classification of hospital. So let us talk about hospital administration. Introduction. Hospital is an institution. Hospital is an institution for the treatment, care and cure of sick and wounded. So as you know, hospital is an institution which render the services like treatment for the patient. So treatment includes cure, care for both sick and wounded people. And hospital also an institution for the study of various diseases. For the study of diseases and for the training of various health personnels like physicians, nurses and other paramedical allied healthcare personnels. So it is an institution where treatment is rendered, care is given, cure is given for the both sick and wounded, and where the study of disease is conducted, various research we conduct in the hospital. So hospital is an institution to conduct the research, so study of diseases and various training program for the medical and paramedical professionals. So training for physician, nurses and other allied healthcare personnel or professionals. Next is about hospital system. So hospital is an organization. As hospital system considered, this concept says hospital is an organization. It is considered as an organization which mobilizes or that mobilizes, motivate the skills and efforts of widely divergent group of professionals, semi-professionals and non-professionals. So hospital consists of different category of personnel, that is professionals, those who are completed professional courses, then para-professionals or semi-professional employees, and even non-professionals like supers and attenders and other non-professionals. So has to provide highly personalized care to the individual patients. So here the ultimate aim is rendering highly personalized, quality and comprehensive care to the patient or individual patients. So hospital is an organization which motivates or which mobilizes or persuades the skills and effort of the various or different widely divergent group of professionals, semi-professionals, non-professionals, thus to provide highly personalized, comprehensive and quality care to the individual patients or group of patients. So as a concept of hospital system, hospital is an organization. So that means hospital is a social and medical organization. The concept of hospital is a social and medical organizations. As hospital is an organization, that is social and medical organization, it includes or it consists man, money and materials. The resources, three important resources. So hospital, as it is a social and medical organization, it consists man, money and material, the three important resources. Man is nothing but the employees, professionals, semi-professionals and non-professionals. That is a manpower or staff or employee of the hospital. Money is to start the hospital, we need a cash, that is capital and budget for rendering the various facilities in the hospital, that is money, second resources. Third resources is material, that is facilities, infrastructure, building and supplies and equipments to render quality and comprehensive nursing care. So hospital is a social and medical organization which consists of three important resources like man, money and material, and as it is an organization, it has a clear-cut vision, that is to render the quality and comprehensive nursing care to the public, that is individual, family and community. Then based on the vision, it has got various strategies like mission, philosophy and set of goals and objectives, purposes to render the services and short-term and long-term goals, various policies, that is rules and regulations and targets to be completed in a particular period of time, and various operations, projects, activities, etc. Then as it is an organization, it has got organization structure and organization chart to render the various activities in the different department of the hospital. So in short, hospital is a social and medical organization. In this slide, you can see that various infrastructure and supplies equipment. So infrastructure like registration department, consulting department, inpatient ward, outpatient ward, then nursing management, then stores and purchase department, pharmacy department, radiology for investigation purpose, radiology department, then laboratory for various examination laboratory, blood bank, operation theatre, and diet and kitchen, that is pantry service of the hospital. So these are the various infrastructure and supplies and equipment in the hospital system that varies. The facilities and infrastructure varies according to the different classification and types of hospital. Next is the definition of hospital. So WHO has given a definition for the hospital, that is hospital is an integral part of social and medical organization. Already we said hospital is an organization that is an integral part, important part of both social and medical organization. The functions of which this social and medical organization function is, hospital function is, which are to provide the population complete health care, the total health care, that is promotive, preventive, protective, curative, etc. all. So to provide population complete health care, both curative and preventive in nature, with outpatient services, that is reaching out to the community or family, with outpatient services reaching out to the family, that is in the specific community or the ward in its own environment, and also to carry out various training program for the health workers or the functionaries of the hospital, that is as we said professionals and semi-professionals, and to conduct a various biosocial research, hospital based research. So according to WHO, hospital is an integral part of a social and medical organization, the functions of which are to provide the population complete health care, that is both curative and preventive, and also outpatient services reaching out to the family in its own environment, that consists home visiting. Okay, so adapted village has to be given under the outpatient services at the home during home visiting. And other functions is to also carry out the various training program for the health workers. So to carry out the training of health workers or functionaries, and at the same time to conduct or participate in various biosocial research. So hospital is defined by WHO as hospital is an integral part of a social and medical organization, the functions of which are to provide the population complete health care, that is both curative and preventive, with outpatient services reaching out to the family in its own environment, and also to carry out training program of health workers or functionaries and the biosocial research. Next is the objectives of hospital. So there are 6 important objectives for hospital. That is, one is to provide optimum, maximum health services to the patient. Second objective is to provide care, cure, preventive services, various preventive services. So care, promotive, preventive, curative, protective, etc. So to provide care, cure, preventive services. Third one is protect the human rights of the clients, of the patients. Protect the human rights, maintaining the confidentiality. Okay, so protect the human rights of the patients. Then fourth objective is to provide training for various professionals who work in the hospital institution. Then fifth one is to provide in-service and continuing education for the employees. So to provide in-service and or continuing education to the employees. Then last sixth objective is to participate in and conduct various hospital, medical based or hospital based research, clinical based research. So these are the 6 important objectives of hospital. First one is to provide optimum health services. Second one is to provide care, cure, preventive services. Third one is protect the human rights of all the patients. The fourth one is provide training for professionals. Fifth one is provide in-service and continuing education to the employees. And last one is participate or conduct various hospital-based research programs or activities or projects. Next is functions of hospital. The functions of hospital can be classified into 2 broad heading, that is intramural function and extramural function. So hospital functions can be categorized or classified. Or there are 2 types of function, that is intramural and extramural. So A intramural, B extramural. So intramural functions are the functions which is rendered inside the hospital. Extramural functions are the functions which is rendered outside the hospital campus. Intramural functions include therapeutic functions, preventive functions, educational functions, and conducting and participating in the research, that is research functions. Extramural function is outside the hospital, that is done as outpatient outpatient services. We said outpatient services reaching out to the community or the family of the patient in the community. Then home care, that is home visiting. Outreach domiciliary services, that is home care based services, and conducting delivery in the home or domiciliary midwifery service, etc. all comes under extramural functions. That is in the house of the client or house of the family. That is called outpatient services. It includes home care, outreach services, domiciliary midwifery services, that is a part of the home visiting. Now let us see the one by one. First one is intramural function. So intramural function first is therapeutic functions, which includes curative care, diagnostic management or diagnostic measures, rehabilitative services, and care of emergencies through the casualty, care of emergencies. So therapeutic means treatment related services. That is the main focus of the hospital. That is curative in nature. That is curative services. That is cure, care, etc. Then diagnostic services, various investigations, then rehabilitation program for the disabled patients, and for the care of in the emergency situation, that is trauma services. Second is preventive services. Okay, that is antenatal and postnatal services for the MCH or RCH. Then well baby clinics, conducting or running well baby clinic or under 5 clinics, and immunization schedule, giving immunization. Then family welfare services or family planning services, conducting sterilization, that is a temporary and permanent method of sterilization. Then control of various communicable diseases, and mass and individual health education or family health education. This all comes under preventive functions of the hospital. Next is the education functions. So some hospitals are categorized as a teaching hospitals, where teaching programs are present, like medical teaching, that is for the undergraduate MBBS programs, postgraduate program for the MBBS doctors, postdoctoral programs of the doctors. Then nursing education, that is B.Sc nursing, undergraduate nursing, postgraduate MSc nursing programs. Then PhD programs, that is doctoral programs. Then various specialty related courses, paramedical courses, community health related courses. Then last is research, that is conducting various hospital based research, includes clinical medicine, clinical area related or clinical based research, and hospital administration based research. So research in hospital administration or ward management based research. So these are the functions, intramural functions of the hospital. Then second is the extramural functions. We are already discussed that extramural function is the functions which is under outside the hospital, that includes outpatient services and home care or outreach services or domiciliary services, that is at the home based home visiting for the patients and its family members. That is extramural functions. So in short, the major functions of the hospital. So you can use the mnemonic, that is hospital, as the major functions of the hospital, that is HOSPITAL. So hospital, H stands for healing services, that is therapeutic services, health services, promotive health services. Then hospital based research, conducting various hospital based research, that is H stands for healing health services and hospital based research. Then O stands for observations, patient early detection, okay, observation, specific examinations. Then O stands for operation, conducting various surgeries, that is through operation theatre operations. Then S stands for supervision, supervision of all health services, supervision of the health personnel, supervision of the services, that is quality and comprehensive services rendered by the various personnel in the hospital. Then P stands for persuasion, that is motivation, the skill and effort of divergent group of people, that is professional, semi-professionals, okay, non-professionals, etc. That is persuasion is nothing but motivation of the service, that is motivation services and preventive services. So community based health services, family based health services, preventive services, antenatal services, immunization services, etc. Then I stands for investigation, conducting various investigation, and I also stands for isolation, separation for communicable disease patient, suppression and treatment, that is isolation. Then in-service training program and in-service education or continuing education for the employees. Then T stands for treatment, so therapeutic services. Then T stands for teaching. I said various hospital is called a teaching hospital. They render various teaching programs like medical, dental, nursing, paramedical, etc. Then training for the health personnel. Then T also stands for transport referral, that is referral services, providing transport to referral to refer the patient to other higher category of services. So referring from primary to secondary, secondary to tertiary, like that. Then A stands for assurance, that is protecting the right of the patient, that is client, assurance. And assurance also include a rehabilitation program, bringing back to the normal, like disability limitation, and rehabilitation program for the clients, those who are having a disability or handicap. So rehabilitation, assurance and rehabilitation. Last L stands for providing needed rest during the disease process, that is leisure, relaxation, okay, during the disease period, okay, relaxation, leisure, and long-term care. So for the chronic illness, like nursing homes rendering long-term care to the terminally ill patients, okay, chronically ill patients, etc. So L stands for leisure and long-term care. So these are the major functions of the hospital as per the mnemonic hospital. The important session of the day is classification of hospital. So hospital can be classified or categorized into various factors. So based on various factors, hospital can be categorized or classified. Let us see what is the important classification of hospital and what are the different types of hospital who render the quality and comprehensive patient care in our country. I have made a mnemonic to understand the classification of the hospital. The mnemonic is famous lyric Stranger in Moscow. Actually, Stranger in Moscow is one of the most important song of Michael Jackson. Like Stranger in Moscow. If you have time, you can just listen this particular one of the most famous song of Michael Jackson, that is Stranger in Moscow. So let us expand the mnemonic, that is famous lyric Stranger in Moscow. So famous stands for function. So hospital is categorized according to its function. Then L stands for, that is lyric, that is L. That is length of hospital care. So hospital can be categorized into according to the length of the period the client or the patient stay in the hospital, like general hospital and nursing home for the chronic patients for a long period. Okay. Then Stranger in Moscow. S stands for size. According to the size of the hospital, bed strength of the hospital can be categorized. Then M stands for management. According to the management, who is the management of the particular hospital, like government, private, etc. Then according to the objectives of hospital can be categorized or classified. So O stands for objective. Then S stands for system of medicines. According to various system of medicine, which medicines they are giving in that hospital, like allopathy, Ayurveda, Unani, homeopathy, etc. The next one is SC, according to the clinical basis, that is general, specialty hospital, super specialty hospital, that is type of clinical services they are rendering in the hospital, that is clinical basis. So C stands for clinical basis. And OW, so last OW I have made together, that is OW, that is ownership or control, according to the ownership and control. This ownership and control and management, according to management, is almost same. So I'll be explaining together, but in the mnemonic I have made M stands for management and OW stands for ownership or control of the hospital. So let us discuss in detail about the type or classification of hospital using this mnemonic. So now you can see the classification of hospital. Don't get upset by seeing that big this diagram. It is very simple. So according to one mnemonic, we can go through that. What are the different type? So first is according to the function. A stands for function. According to the function, hospital can be classified into primary hospital, secondary hospital, and tertiary hospital. So some hospital function they provide only primary health care. Next, other group of hospital they provide secondary health care, and other group may provide tertiary health care. So according to the type of the health care, that is according to the function of the hospital, hospital can be classified into three: primary, secondary, and tertiary hospital. Next is according to the length of stay in that particular hospital. So we have short-term hospital and a long-term hospital. So short-term hospital means patient will stay only for a short period. Okay. The long-term care is, that is patient stay for a long period for a chronic illness. So short-term hospital will be for the treatment for the acute illness, that is immediate treatment, and patient will be get discharged. Long-term hospital means patient stay for a long period, like nursing homes, so they treat the old age patients. Okay, or chronically ill patients, they need more period of or long-term care. That is according to length of stay. Third one is according to the size. That means according to the bed strength, we can classify the hospital as a PHC, CHC. PHC means primary health center. CHC is community health center. Then taluk headquarters hospital, district hospital, subdivisional hospital, medical college hospital, etc. So according to size, hospital can be classified into PHC. PHC actually health center, but we have 4 to 6 beds to treat the patient. Then there is no inpatient services, but we have outpatient services. Then CHC we also called a rural hospital, starting with 30 beds. So it is a 30 bed rural hospital. Then taluk headquarters hospital, district hospital, medical college hospital, etc. Then according to the management, so we have public hospital or government hospital. So that is managed under government management. Then we also have semi-government, government supported or semi-autonomous organizations for under the services, patient care services as hospital. Then we have cooperative hospitals. So cooperative hospital function under cooperative society system. They are not public, they are not private. So cooperative. Like that we have a voluntary hospital. Those are under voluntary services. Then we have corporate hospitals, that is company related hospitals like Reliance, Hinduja, Apollo Hospital, etc. Corporate hospitals. Then of course we have a number of private hospital by private management or a group of private person together may run various different type of hospital, that is private hospital. So under management, according to management, hospital can be classified into public, government. Government also we can classify it into central government, state government, etc. Then semi-government or semi-autonomous. Then cooperative hospital, voluntary hospital, corporate hospital, private hospital, etc. Then according to objectives of rendering services by the hospital, we can classify the hospital as a teaching hospitals, like medical college is a teaching hospital. Then general hospital or specialty hospital. General hospital render only general services. So it's a short-term hospital that give a general services, but specialty hospital render only specialty services like a TB hospital, cancer hospital, pediatric hospital, etc. Then third classification according to objective is long-term care hospital, that is nursing home. We already said here long-term and short-term. So long-term care hospital or nursing homes according to objective services for the chronic patients. Then rehabilitation hospital to run the rehabilitation program. So rehabilitation. Then referral hospitals. So all the referral cases will be treated in the referral hospital. Like CMC Vellore is a referral hospital. Then isolation hospital, that is communicable disease patient can be categorized and they are treated separately. That is isolation hospital. Then according to the system of medicines, hospital can be classified into according to the system of medicine, that is Ayush. Here Ayush I have made 2A, that is one is allopathic medicine, that is English medicine. Then Ayurveda, Yoga, Unani, Siddha and Homeo medicine, that is Ayush. So according to the system of medicines, that is Indian system of medicine or indigenous system of medicine, hospital can be classified into Ayush. Okay. Then according to clinical basis, according to clinical services, general hospital, specialty hospital, super specialty hospital and research center. So conducting various research program in the research center, that is research hospital. Then according to ownership and control, ownership and control is as equal to the management, the same classification, only the same hospital comes under ownership and control. So these are the classification of hospital according to the function, according to the length of stay, according to the size, according to the management, according to the objectives of hospital, according to the system of medicine they provide, according to the clinical services they render, and according to the ownership and control. So in this video you can see according to function, primary hospital, that is PHC. PHC render the primary health care or comprehensive primary health care to the patient. Secondary hospital like community health center, taluk headquarters hospital, subdivisional hospital, all render secondary health services, so that is community health center. Then tertiary care hospital render only tertiary care to the patient, that is district hospital, then medical college hospital, super specialty hospital, etc. So this is a classification according to the functions. Now according to the size, that is according to the bed strength. So PHC 4 to 6 beds, CHC community health center 25 to 30 beds. This is called a rural hospital. And taluk headquarters hospital consists of 31 to 100 beds. Now it is varies, but according to the book picture now I am explaining. Then district hospital from 100 to 500 beds. So next is the teaching or medical college hospital. The bed strength is above 500. So these are the hospital classified according to the size of the bed strength. So hospital also can be classified according to the size of its bed strength. So next let us see in detail about the hospital categorization according to the management of the hospital or according to the ownership and control or ownership or control. So we already said it is public or government hospital, then semi-autonomous hospital, then cooperative hospital, voluntary agency, voluntary hospital, and private hospital. So public or government hospital again can be categorized into central government hospital, state government hospital, local body hospital, etc. So central government hospital is under the direct control of the central government. So it may be also called autonomous hospital because it is mostly controlled by the Ministry of Health and Family Welfare, central government. Ministry of Health and Family Welfare. So for example, we have a central government autonomous hospital like NIMHANS Bangalore. Then we have AIIMS New Delhi. These are central government hospital or autonomous hospital. So AIIMS Hospital Delhi and NIMHANS Bangalore all comes under autonomous hospital, that is completely controlled by the central government. Then state government, each state government has their own hospital. Like Kerala state, we have ESI hospital, that is Employee State Insurance Hospital, is under the direct control of the state government. Even prison hospital in the state is under state government control or management. Then state government, I already said, that is ESI hospital. Okay, ESI hospital, Employee State Insurance Hospital, is a state government hospital. Then various other state-run hospital like leprosy sanatorium, TB sanatorium, etc. all comes under prison hospital. Also we said all comes under state government hospital. So next is according to the local bodies. So public or government management or hospital can be categorized into central government hospital, state government hospital, and local bodies hospital. Local bodies include panchayat. In panchayat we have a primary health center. Okay. Then second is block. Block we have a community health center or rural hospital. In municipality and corporation area we have a taluk headquarters hospitals, then subdivisional hospital and district hospital, etc. Hospital also can be categorized or classified under local bodies. So under management or ownership or control, we have first public or government hospital, that is union or central government or national government running hospital, that is called autonomous hospital because it is controlled by Ministry of Health and Family Welfare. And we have state government, that is our regional hospital, and we have a local bodies hospital, that is a non-commercial hospital. Okay, it is not a business hospital, it is rendering various services at free of cost. That's what it is called, so non-commercial lines hospital. And it may be general hospital, it may be specialized hospital, or it may be both. Then next is semi-autonomous. Semi-autonomous is that is partially supported by the government. Okay, that is railway hospital, military hospital, defense hospital, etc. It is semi-autonomous hospital. Though it is a semi-government hospital, they have their own self-ruling, independent, sovereign, and they are self-sufficient. Then they are self-governing, they can make their own control, etc. So that is include military hospitals, railway hospitals, etc. all comes under semi-autonomous categories of hospital. And cooperative, we already said, that is under cooperative society it comes. It is not by public or it is not private. Actually this hospital is developed in 1930s, cooperative hospital. They offer a solution for the problem of rural communities. Okay, and they provide affordable access to quality healthcare services, and that is a locally developed and managed prepaid healthcare services. Actually, cooperative hospital function under or the management of the cooperative hospital is Cooperative Hospital Service Organization, that is CHSO. So they have got a number of hospital under this Cooperative Hospital Service Organization. So they have ventures with the other hospitals. So cooperative hospitals function under the management of Cooperative Hospital Service Organization. India's first cooperative society hospital is Sri J.G. Cooperative Hospital and Research Institute, Belgaum district, Karnataka, India. So this is the Sri J.G. Cooperative Hospital and Research Institute, Belgaum, Karnataka state. So this is the first cooperative society hospital in India. Then voluntary hospital, we have voluntary agencies. So it is a charitable non-government hospital. Voluntary hospitals are the charitable non-government hospitals runs with the public or private funds. So they make a public fund or private fund and they are the charitable institution. Actually this voluntary hospital established and incorporated under Societies Registration Act. So they have to register the hospital as Societies Act, that is 1860, or Public Trust Act 1882, or any other appropriate act under central or state government, they can run the voluntary hospital as charitable non-government hospital, and they function with the private or public fund. So this is about the voluntary hospital. They are under the voluntary health services to the citizen in our country. Then corporate, I already said, that is company run hospital is called the corporate, like Reliance Hospital, Apollo Hospital, Hinduja Group of Hospital, etc. So the hospital which are public limited companies, so they run by various public limited companies, that is formed under Companies Act. So these hospitals has to register under Companies Act, corporate hospitals. So they may be the general hospital, they may be the specialized hospital, or they both. And they run the hospital on a commercial basis or business basis, like private hospital. It is a commercial basis hospital. Example, Hinduja Hospital, you can see that Hinduja Hospital, Apollo Group of Hospitals, and even Reliance Hospital, etc. all comes under corporate or company hospitals. Then private hospital, we have already discussed, like a individual private hospital or a private organization, partnership private hospital, partnership organization, trust hospitals, religious hospitals, etc. So they are generally owned by an individual doctor or a group of doctors together. They can, as a partnership, they can make a hospital. That is called a private hospital. This hospital mainly run with a commercial basis or business basis or business purpose. Okay. And it may be mainly focused on the curative services. So the private hospital is run on a commercial basis or business basis, profitable basis. So these are the main hospitals, 6 category of hospital which comes under management or ownership or control. Next is under system of medicine. I already explained that is under system of medicine, which medicines is given in the particular hospital or focus in the particular hospital. Hospital can be categorized into allopathic hospital, that is English medicines followed in allopathic hospital. Then Ayurveda followed in Ayurveda hospitals. Yogic and naturopathy we have, that yoga therapy is applied in yogic hospital. Naturopathy applied in naturopathy hospital. Unani system of medicine is applied in Unani hospital. Siddha medicine is followed in Siddha hospital. And homeopathy treatment is given in homeopathy hospital. So this is about the topic of hospital administration. So far we have discussed about the hospital administration, which includes a definition of hospital, objectives of hospital, functions of hospital, and the various classification of hospital. So hope this video really benefits in your studies and exams. And if you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next an important academic related video. Thank you.